Okay, so you're probably here because either you have liver disease, someone you know has liver disease, you think you might have liver disease, or you are super, super interested in liver disease and game on for coming for this today on a Saturday afternoon. And you've heard all about, the good, the bad, the ugly of what can happen. And now you're thinking, well, this is all well and good, but we live in Nova Scotia where the majority of people have no access to primary care or live about 2.5 hours from Halifax, Nova Scotia. So how in the HE double hockey sticks do you expect me to do with all the information you've given me? And that's why I'm here. Like Vanna White. So I want you to think about chronic disease and liver disease as a puzzle. You can apply this to any chronic disease you might have, but today we're talking about liver disease. So everybody's puzzle is a bit different, right? It could be a 500 piece, it could be a 5,000 piece, depending on what kind of disease you have, what caused your liver disease, and how far along that roadway of progression you have, your puzzle will look a bit differently. But it has core elements that are always the same. So you have a number of different specialists that will be involved in liver care. We're going to talk about them in terms of these puzzle pieces. So your number one person that you're going to go to is your primary care provider. Primary care providers in Nova Scotia and mostly across Canada can be a family physician, so a medical doctor, or in some cases it can be someone like me, a nurse practitioner. Sometimes we work independently, sometimes we work together, sometimes we have a collaborative team that have nurses involved as well. They are the foundation of your health, so they form the outside border of your puzzle. I think we can all say the easiest thing to do in a puzzle is the outside border, right? Easy to find the pieces, they have a flat edge on them. Put them all together, you have a foundation to start with. So your primary care people, I want you to think about it as your foundation. They're your first go-tos. If you think you might have liver disease, if you want to know if you have liver disease, those are who you reach out to first. Then you might tell me to, I can already see a few heads looking at me going, and I bet you're the ones that are going to tell me, I have no primary provider care, what the heck am I supposed to do in Nova Scotia? This is where virtual care Nova Scotia comes into play. And I know that virtual care, I know that it's a bit of a roadblock for people because virtual care is a little bit impersonal. I agree it is. However, right now that's what we have access to. The key is that everybody in Nova Scotia has free access to a primary care provider by way of this platform. If you are on a primary provider list or need a family practice list, you have access to this service. You can get your screening, your blood work, your tests, anything you need to do for your primary liver disease screening can be done through virtual care. And if you are determined to need a physical assessment, there are ways for that to happen via virtual care. So please don't not use it because it seems impersonal. I agree, it is, but it is a resource to use if you have nothing else. So along with your primary care providers, you have allied health professionals. Now these people might be people you find within a primary care setting, or they can be people who you will pay for their services individually. It depends on where you're at. If you have liver disease, or if you think you have liver disease, you probably will have some sort of other chronic disease. So if it's metabolic liver disease you think you maybe have hypertension, maybe you have diabetes. There are allied health professionals who can help you. So for example, dietitians or nutritionists, physiotherapists, psychologists, anybody who does counseling, diabetes education centers. So as an example, if you have diabetes, you can self-refer to a diabetes education center in Nova Scotia. You do not require a referral from a provider. Why is this important if you think you have liver disease? Well, diabetes isn't going to make it any better. And if you go to that center, you might have to go through a few hoops, but you'll have access to providers who can then refer you on to somebody who's more specialized if your blood work or your investigations deem that to be necessary. So reach out to other areas that you have that might not traditionally be a liver-specific specialist. And then you have your specialists. And we're going to dive into a bit more of this, it's just kind of introduce you to these people. So you're a specialist, so you have your border of your puzzle. Those are your primary care providers. You have your allied health professionals. So those are the people who typically wouldn't be liver specific, but they're going to fill in a few little pieces of the puzzle here and there. That's kind of like if you do your border of your puzzle and then you go and find all of your blues, all of your greens, all of your yellows, put them into separate compartments and then start making your puzzle. It makes it easier to put it all together in the end. They all have their own little special portion to do. Your specialists are the last few puzzle pieces that are those little tiny, those hard to find ones that you got to try every single piece you have in the pile until it fits the hole that's left for you to fill in. That's where a specialist comes into play. There's a number of different specialists in Nova Scotia that you might be referred to. You may be referred to someone called a general internal medicine specialist. This is a doctor who is specialized in internal medicine. Their knowledge is broad, from your head to your toe. You may be referred to a gastroenterologist. This is somebody who has done internal medicine specialty training and then done a little bit more specialty training for gastroenterology. That's your digestive system, your liver, your pancreas, that kind of stuff. If you are a liver patient, you maybe have had a scope done before. Has anyone had like a gastroscope done, a little camera go down to your stomach before? I see some nods. Likely a gastroenterologist is who did that. Could have been a general surgeon, but typically it's a gastroenterologist. A hepatologist is a gastroenterologist typically with even more training specific to liver disease. So that's an even more specialized person. And then you have your hepatobiliary surgeons, who are the ones that if there's something going on with your liver, that we can cut it out, replace it, fix it, tie it together, do something different, they're the ones who get involved. So a number of different specialists can be involved in liver care. The important and reassuring factor, but also sometimes a maddening factor, is that the majority of individuals who have liver disease won't need these people. Most people who have liver disease, if your liver disease is managed, don't require the services of these individuals. That's a good thing. That's like going into emergency and have to wait for 7.5 hours to see someone. It sucks. We hate it. We see all the people going in before us, but it's because we're not sick enough to require the services. It's maddening sometimes, but the underlying current is it's a good thing. If you're not that sick, you can be managed with your primary care provider, and that's fantastic. So you say, okay, well, if I can be managed with my primary care provider, but I go in and I have a 15-minute appointment, only one question that I can ask them. How many people have had that conversation before? Yep. I can say I used to work in primary care, guys, so I can make all these comments. So yeah, you go in, I have one question to answer. I think I have liver disease. If you think you have chronic liver disease, so if you have risk factors being if it's metabolic, are you diabetic? Do you have hypertension? Are you overweight? Do you have an autoimmune disorder that is sometimes connected to liver disease? Do you have Crohn's disease? Do you have ulcerative colitis? Do you have a family member who had some sort of liver disease? Do you have a family member who had liver disease, but you don't know what it was, but you know it's something really weird and wonky and they had to go have surgery and I don't know what it was? These are all risk factors that your primary care provider is going to want to know about. That influences what we look at, the tests we do, and the investigations we want to take on for you. So if you think you have risk factors for liver disease, I want you to book an appointment with your primary provider, be it the one you have or be it Virtual Care Nova Scotia. And you're going to tell them, and I actually picked this stuff up at the back. I didn't know this existed. Liver Canada has some great resources. If you haven't gotten these before you go, I want you to pick it up. Because this tells you what's my normal liver function range. So if you're going to get some blood work done, the very first thing you're going to have done is blood work. It sounds simple. It's not. But it will tell us a lot about your liver function and if it's happy or not. Remember, liver function test, how's my liver doing? Liver enzymes, is my liver happy or unhappy with me? Here are your normal values. This is important because every one of us also has access to something called Your Health Nova Scotia. It's a website or an app if you want to use it. It provides you with access to every blood work result that you have, and sometimes your ultrasounds too. And as a provider, it sometimes drives me crazy because then people call and say, oh, I had these numbers and these numbers will go to whack and now I have to explain them. But the reality is that you now will have the normal levels. So if you take this with you, you'll know, am I normal or not? And if I get my blood work done once a year, is it different from last year or is it the same? Put that ball into your own court. We talked a bit about investigations already, so I won't get into those things, but this is just to remind you that if you travel down that road of liver disease, so if you go into your primary care provider, excuse me, and they say, okay, well, your liver enzyme's a little bit off, your liver function tests are okay, a little bit wonky, maybe you had an ultrasound that says you have liver disease or you have fat in your liver or something strange with your pancreas, who knows? They're going to send you off to some sort of specialty service. It might not necessarily be a liver specialist right off the get-go. Likely you'll have a fibroscan done first. Now in Nova Scotia right now, it does go through the liver program to have a fibroscan done, but that doesn't necessarily tie you to a hepatologist at that point in time. It gets you the testing done for further investigations. Okay? Knowing what these tests are is empowering because that way when the doctor says, well, I think you probably need to have one of these things done, you understand what it is, what to look for, what to ask for, so that if you end up say your family doc says, well, your liver function is a little bit off, I'm going to send you for a fibroscan. But the fibroscan will take a while. 6 months down the road, you have an issue. You wake up in the morning and your skin's yellow. You don't know why. You go into Emerge and say, well, I don't really know why my skin's yellow. One or two things will happen. They'll either go through the entire panel of investigations all over again, which is important. But if you already know, well, my doc said my liver function is off and I'm going for a FibroScan, that will tell your provider a lot of information about your liver disease and the underlying diagnosis that you may or may not have. It gives them the step A, B of the 26-letter steps that they have to take. So write it down, keep track of it, hence the second page that was up there on the back. Put your information down, take it with you. And if somebody rolls their eyes at you, because sometimes we do, and I'll admit I've been that nurse before and emerged, rolling my eyes at people bringing the stuff in, the binders in, what does it matter? You have the information you need. So then we want to talk about, so when do we get the specialists involved? So when I worked in primary care, the number one issue that I had, or the number one issue people came to me with was, I have liver disease. I want to see a hepatologist. And I had to go through this process of really wanting you to refer someone to a hepatologist. And I can speak on their behalf, I think, to say that the hepatologist would love to be able to see every single person in Nova Scotia who has liver disease. 100%. We just can't. So who gets to see specialists? They're the sicker of the sicker people. Typically, if you have liver disease that is managed and your liver is functioning well and it's caused by some sort of underlying diagnosis that we know about, metabolic disease, maybe it's autoimmune disease, but you've seen someone in the past and it's been doing well and it's been well managed, typically we might see those people once over the course of 5 or 6 years maybe, or maybe not at all if you're doing really well. But if you have some weird or wonderful underlying diagnosis, some genetic disorder, some weird family thing, or you have a diagnosis of liver disease but we don't know what's caused it, those are the people who will typically come and see a specialist because they need further investigations to be done. And it's a long process, and it's frustrating because it takes forever for it to get done. Know that in the background, you get monitored, you are being monitored, and we are triaging you on a system that we do the best we can with the resources we have. What that means for you, though, is you know you have liver disease, you know you're waiting to see a specialist. Make sure you continue to keep track of your primary care provider. Stay up to date with your blood work. Usually once every 6 months you check your liver function and your liver enzymes if you're stable. Know what they are, follow it on the app. If it changes, that might change how you're triaged. Your provider can always send a note in and say, hey, you know what, there's been some changes, does this look okay? You might not physically see someone, but your information may be reviewed with the team if it is significant. And if it's significant, we'll be able to flag it and we'll see you sooner. So I know it's frustrating. I know it's frustrating for us as well. But we do try to provide the best care we can, kind of overbranching to everyone with all the resources that we have available. So some take-home points for navigating the system. The biggest ones for you guys is going to be primary care. And I don't know, I guess a show of hands, how many people do not have a primary care provider in this room? Yeah. Are you all on a needed primary care provider list? Yeah. Do you? Yeah. Mm-hmm. Mm-hmm. Yes. So here's the key. And this is me speaking off the cuff. You shouldn't have to. You're right. You're absolutely right. You shouldn't have to. There should be someone that says, hey, they should go back on the list. But here's the reality. You got to advocate for yourself, girl. You have to be the one to say, you know what, I need a family provider and I need to be on that list. The second part of this is you can update your health information on the list. So if you get a new diagnosis, so if you went on that list a year and a half ago because you had high blood pressure, but now you have chronic liver disease, now you have diabetes, you go back online or you call them and you update your profile. It is triaged based on the severity of your diseases and what has to happen. If you wound up in Amherst Emerge because you started to, I don't know, maybe you went yellow one morning, you don't know why, but it was okay, and you're waiting to see hepatology, but you don't really know, put that on your list because it's going to get you a family provider sooner than somebody who's otherwise healthy and well. So important to keep that updated. Second thing is your virtual care, your My Health Nova Scotia app. Get that, keep it updated because it gives you all the information you need in your hands. Not every system in Nova Scotia talks to one another. So if you have stuff done in Amherst, Nova Scotia, it might not show up in Halifax, Nova Scotia on our systems. It should, you're right, but it might not. So advocating for yourself and having that data available could be beneficial. Okay. The other thing that you can do for your own health is to use Liver Canada's resources. So every time I see a patient in clinic, I would always tell them to go see liver.ca. Liver.ca is Liver Canada. It is peer-reviewed information. So professionals, like Dr. Jusen on the board, or professionals have reviewed the information that's on that website, and it's accurate. But it's also in information in bite-sized pieces that we can understand as a lay person as opposed to having a health degree. So they give you resources to carry around, bite-sized information of what you can do, lifestyle modification choices, that kind of stuff. Rather than just Googling randomly, because sometimes you can get down the Google hole, I say, or the rabbit hole, and not know where you're going, use things like Liver Canada. Okay. The last thing I will talk about is that we did talk a lot about sort of general liver disease and what liver disease looks like in a relatively healthy individual. Now I'm looking out in the room, and I think every healthcare provider will look at people and say, okay, kind of get a lay of the land of like how people look and how they're doing. No one looks to be terribly, in distress right now. But we have mentioned compensated versus decompensated liver disease, and it's a show of hands who is like really certain that they know what decompensated liver disease looks like. Yeah, exactly. So most liver disease is not going to progress to a decompensated state. Most of them won't, and we typically shy away from it because it's scary. The idea of what could happen is scary, but it is important to know. If you have liver disease and you have cirrhosis, whether you know you have cirrhosis or not, there are 3 key markers that we look for that are emergencies in our book. One of them is something called ascites. So if over the course of a couple weeks to a month, you go from being, well, I'm not a skinny person, so I'm not a good candidate, but if you go from being Dr. Drew's size to my size, your belly gets really bloated with fluid, you find that you're short of breath, you have to go to Emerge, get that checked out. That's one complication of the disease that we need to treat immediately. Sometimes it's medication, sometimes it's something else, but still, don't wait, get it checked out. The second thing is if you have bleeding. So we talked about liver disease and how liver disease can cause changes in clotting factors. The particular type of bleeding that I'm talking about comes from different complications that we're not going to talk about today, but the important thing to know about is that sometimes you can get sick to your stomach, and what comes up can be bloody. Or you can have a bowel movement, and what comes out is really dark and sticky. Something very strange from what your usual stool will look like. Those are emergencies. You go to the emergency department, you get assessed, and you walk in and you say, I have liver disease, and I might be bleeding. Don't know what to do. The third one is important for your families. So because your liver is important for filtering all those toxins in your body, toxins that are naturally occurring in your body but have to get rid of, if your liver doesn't filter them correctly, your brain can be impacted by that. And what that looks like are very subtle changes. So perhaps you're driving through the exact same community you've lived in for like the last 15 years. You get to that one stop sign in the middle of the community, and you don't know if you're left or right. And it takes you a second. I'm like, oh yeah, right, I go left. Okay. That could just be old age coming on too, and fair enough. But if it happens frequently, if your family starts to notice that you're getting irritable or you're forgetting things, that's a complication. It's a big long term for it, but really all you need to know is to go into the emergency department and say, I have liver disease and I'm confused. I don't know what's going on. Those are 3 hallmarkers of advanced liver disease that's decompensated. Now, looking around, Jen, I can't medically endorse that y'all are looking pretty good, but you're looking pretty decent to me up here. But if you or someone you love has those 3 things happen, please, even if it takes 16 hours in Emerge, because sometimes it does, please go and get assessed. It's a straight shot to seeing someone like me, I suppose, if you do that. But I'm lovely, so why don't you come see me anyways? Okay.